Welcome to the Global Health Bulletin, your trusted source for the latest updates in world health, vaccines, disease outbreaks, and medical breakthroughs. Today is July 4th, 2025. Let's dive into today's top global health headlines. Good day and welcome to the Global Health Bulletin for July 4th, 2025. Over the next 20 minutes, we'll bring you the most important updates in global health, medicine, vaccines, and disease outbreaks around the world. Today's top stories. A vaccine confidence crisis erupts in the United States as changes in CDC leadership cause concern. Gavi secures $9 billion for global immunization, while the U.S. withdraws key funding, threatening the health of 75 million children. Oropouche virus spreads to 12 more countries, raising fears of urban transmission. Senegal and Nigeria launch breakthrough vaccines against major diseases. And measles and dengue flare-ups strike the Americas and Europe, while mpox strains African health systems. Let's begin in the United States. Health Secretary Robert F. Kennedy Jr. has appointed several anti-vaccine figures to the CDC's Immunization Committee, raising alarm among public health experts. Reports suggest that the member vaccination schedule may come under review, while the FDA maintains that stockpiles of flu and COVID-19 vaccines are sufficient for the upcoming season. Confusion and misinformation have led to a 17% drop in bookings over just 2 weeks. The American Academy of Pediatrics warns that a 5% drop in member coverage could triple measles outbreaks. Parents are urged to follow the current CDC vaccination schedule and verify all information from official health sources. In parallel, the U.S. Congress has passed the so-called Big Beautiful Bill, which slashes funding for Medicaid and other public health programs. The Congressional Budget Office estimates $210 billion in cuts over the next 10 years, with low-income Americans expected to be the most affected. Researchers warn this could further widen the health gap between wealthy and disadvantaged populations, but there is promising news from Geneva. At the 2025 Gavi Summit, global donors pledged a record $9 billion to fund vaccinations through 2030. The funding aims to protect 500 million children from 18 preventable diseases. However, the United States withdrawal of $1.2 billion per year leaves a gap that could leave 75 million children without access to essential vaccines. Gavi is urging G20 countries to step in and close the funding shortfall by October. Meanwhile, in Africa, Senegal has successfully added the 6-in-1 hexavalent vaccine to its national immunization schedule. This combination vaccine reduces infant injections from 9 separate doses to just 3, saving over $2 million annually in logistics.
Nigeria has also introduced a 5-strain meningococcal vaccine, known as Men5CV, targeting regions previously devastated by meningitis outbreaks. In the United States, the CDC now recommends OSV-ARV vaccines for adults aged 50 to 59, extending protection to an additional 12 million people. However, in Europe and the UK, regulators have temporarily suspended the chikungunya vaccine IXCIC for people over 60 after reports of rare neurological side effects. Now for a roundup of global outbreaks. Oropouche virus transmitted by biting midges has infected over 23,000 people across 6 South American countries. It has also been detected in Texas and Ontario. The World Health Organization now lists it as an emerging global threat, and no vaccine currently exists. Mpox continues to spread across Africa, with 21,000 confirmed cases so far this year. The Democratic Republic of Congo accounts for nearly half of them, with 9,000 cases. Around 700,000 doses of the Jynneos vaccine have been distributed, but at least 1.6 million more are urgently needed. In the Americas and Europe, measles has resurged. The United States has reported 7,132 cases and 13 deaths this year. Belize has also recorded its first outbreak in 34 years. Meanwhile, France has documented 500 chikungunya cases, prompting travel advisories from WHO and the European Centre for Disease Prevention and Control. Additional hotspots include malaria outbreaks in the Quito province of the DRC, with 1,100 cases and 60 deaths. Central Europe is dealing with over 2,000 hepatitis A cases and 9 deaths. Cholera is resurgent in Sudan and Myanmar. And public health experts warn that yellow fever could spread to the Asia-Pacific region if mosquito control programs are not strengthened. On the innovation front, the World Health Organization has extended its global digital health strategy through 2027. From July 14th to 18th, WHO will host the Global Initiative on Digital Health virtually. Key topics will include AI in diagnostics, wastewater surveillance, global data standards, and workforce development in 36 low-income nations. Looking ahead, here are a few upcoming global health events. The second Global Convening on Digital Health will be held online from July 14th to 18th. The Global Conference on Climate and Health is set for July 29th to 31st in Brasília, Brazil. And in September, the 78th World Health Assembly will take place in Geneva. Finally, here's some timely public health advice. If you're traveling this summer to the Mediterranean, Caribbean, or Southeast Asia, take extra precautions against mosquito-borne illnesses. And before heading to Latin America or Central Africa, make sure your routine vaccinations are up to date. That's the global health picture as of July 4, 2025. Thank you for listening. Stay informed, stay safe, and we'll see you next time.
You've been listening to the Global Health Bulletin, bringing you the critical health news that matters. This episode was recorded on July 4, 2025, with data from trusted sources including the WHO, CDC, Gavi, and global media reports. Stay safe, stay informed, and don't forget to subscribe or follow us for daily updates on global health. Thanks for listening, and see you next time.